Have you ever winced in pain just from touching your testicles and wondered what's going on down there? It might seem minor, but that discomfort could be your body's way of warning you about something serious, maybe even life-threatening. In this video, we'll uncover the real reasons why your testicles hurt when touched and what you must do before it's too late. Testicle pain is a sensitive and often alarming issue that many men experience at some point in their lives. When pain occurs just by touching the testicles, it may raise serious concerns. In this voiceover, we'll explore the most common and medically recognized causes of testicular pain, along with the underlying mechanisms behind them. Let's begin with the basics. The testicles are extremely sensitive organs. They are located in the scrotum, outside the body, which makes them vulnerable to touch, injury, or infection. Even slight pressure or trauma can cause discomfort or pain. But if you're experiencing pain even with light touch, there might be something more going on. The first and most straightforward cause is trauma or minor injury. Perhaps you bumped into something, sat down awkwardly, or experienced a sports-related impact. These minor traumas might not cause visible bruising, but can lead to tenderness that lasts for days. The testicles are packed with nerve endings, making them highly responsive to even the smallest irritations. The second possible cause is epididymitis. This condition refers to inflammation of the epididymis, a coiled tube located at the back of each testicle that helps store and carry sperm. Epididymitis is often caused by bacterial infections. In sexually active males, it's commonly due to sexually transmitted infections, such as chlamydia or gonorrhea. But in younger boys or older men, it could be a result of a urinary tract infection or even a prostate infection. When the epididymis becomes inflamed, the surrounding area becomes swollen and sensitive. Even gentle touch may trigger discomfort or pain. Associated symptoms may include fever, a heavy sensation in the testicle, discharge from the penis, or pain during urination. Another important cause is orchitis, which is inflammation of the testicle itself. Unlike epididymitis, which affects the tube behind the testicle, orchitis involves the entire testicle. This condition is often linked to viral infections, most notably mumps. If a man contracts mumps in adulthood, there is a high chance the virus may travel to the testicles and cause inflammation. Orchitis can affect one or both testicles and often presents with swelling, redness, and tenderness to touch. If untreated, it may cause permanent damage and even affect fertility. Now let's discuss varicocele. A varicocele is an enlargement of the veins within the scrotum, similar to varicose veins in the legs. These veins can become twisted and enlarged, leading to a heavy, aching feeling, especially after standing for long periods. While some men with varicoceles are asymptomatic, others experience pain or a dull discomfort, especially when touching or pressing on the scrotum. Another serious cause of testicular pain is testicular torsion. This is a medical emergency. It occurs when the spermatic cord, which provides blood flow to the testicle, becomes twisted. The twisting cuts off blood supply, leading to severe and sudden pain. Even the slightest touch may cause intense discomfort. The affected testicle may be positioned higher than usual or angled oddly. Accompanying symptoms can include nausea, vomiting, and swelling. Testicular torsion is most common in adolescents and young adults, but it can happen at any age. Immediate surgery is required to save the testicle. Waiting too long can lead to irreversible damage or the loss of the testicle. Now let's look at hydrocele. This condition involves a fluid buildup around the testicle, causing swelling. While most hydroceles are painless, some can cause discomfort if they become large or tense. A hydrocele often presents as a smooth, soft swelling in the scrotum and may feel tender to touch. A related condition is spermatocele, which is a fluid-filled cyst that forms in the epididymis. Though typically painless, a larger spermatocele may cause a feeling of pressure or sensitivity when touched. Moving on, let's talk about inguinal hernia. A hernia occurs when a portion of the intestine pushes through a weak spot in the abdominal muscles and extends into the groin or scrotum. This can lead to a visible bulge and discomfort, especially when lifting, bending, coughing, or touching the area. The pain might radiate to the testicle because of the close proximity of the herniated tissue. In some cases, men experience referred pain. This means the pain felt in the testicles is actually originating from another part of the body, like the abdomen, kidneys, or groin. Conditions like kidney stones, lower back problems, or infections in nearby structures can refer pain to the testicles. Let's not forget testicular cancer. Although it's relatively rare, one of the warning signs is a painless lump or swelling in the testicle that gradually becomes tender or painful. Some men may first notice discomfort when touching or examining their testicles, which prompts a medical visit. Regular self-exams are important for detecting changes early. Infections of the urinary tract or prostate can also cause testicle pain, especially during or after urination, ejaculation, or physical activity. These infections often travel from the urethra to the prostate and down to the testicles. Now let's consider another factor: nerve-related causes. Sometimes the nerves that supply the scrotum and testicles can become irritated due to conditions like a herniated spinal disc or diabetic neuropathy. This irritation may cause hypersensitivity or pain when touching the testicles, even if the testicles themselves are structurally normal. Psychological factors can also play a role. Men who are highly anxious about their health or constantly checking for abnormalities may inadvertently cause testicular discomfort through frequent handling. This can lead to a cycle of anxiety and physical sensitivity. Lastly, there are cases where testicle pain is labeled as chronic scrotal pain syndrome. This diagnosis is made when no clear cause is found despite extensive testing. The pain may persist for months and is sometimes associated with nerve irritation, past infections, or unresolved inflammation. Understanding how doctors diagnose testicular pain can give us more insight into what might be going wrong. When you visit a doctor for testicle pain, they typically begin with a thorough physical examination. They check for swelling, tenderness, lumps, or differences in the size or position of the testicles. This initial check can provide important clues about the underlying cause of your discomfort. In addition to the physical exam, the doctor may ask detailed questions about your symptoms. These questions include when the pain started, whether it's constant or comes and goes, what makes it worse, and whether you've had any recent injuries, infections, or sexual activity. Providing honest and accurate information can help the doctor reach a quicker and more accurate diagnosis. Depending on what the doctor suspects, imaging tests like a scrotal ultrasound may be ordered. This is a painless and non-invasive procedure that uses sound waves to create images of the testicles and surrounding tissues. It helps detect conditions like torsion, like epididymitis, tumors, hydroceles, varicoceles, and more. Blood flow can also be assessed, which is especially important when torsion is suspected. Urine tests may also be done to check for signs of infection, such as white blood cells, bacteria, or blood in the urine. If a sexually transmitted infection is suspected, the doctor may recommend a swab test or specific STI panels. Blood tests might also be ordered to check for signs of inflammation, infection, or tumor markers if cancer is a concern. Now let's talk about treatment. The treatment for testicle pain depends entirely on the cause. For minor trauma, rest, ice packs, and over-the-counter pain relievers like ibuprofen or acetaminophen are often enough. Wearing supportive underwear, such as briefs or an athletic supporter, can also reduce movement and ease pain. If the pain is due to epididymitis or orchitis, antibiotics are typically prescribed. The exact medication depends on the bacteria causing the infection. If a sexually transmitted infection is the cause, both you and your sexual partner may need treatment. Anti-inflammatory medications, scrotal elevation, and bed rest may also help reduce symptoms. In the case of testicular torsion, immediate surgery is the only option. The sooner the surgery is done, the better the chances of saving the testicle. Ideally, the surgery should happen within 6 hours of the onset of symptoms. During surgery, the testicle is untwisted and stitched to prevent future twisting. If the testicle is severely damaged, it may need to be removed. For conditions like hydrocele or spermatocele, surgery may be needed if the swelling becomes large or painful. These procedures are generally simple and performed on an outpatient basis. Varicocele treatment depends on severity. Mild varicoceles may be managed with observation and lifestyle changes, while more severe cases might require a surgical procedure known as varicocelectomy, which removes or blocks the affected veins. For inguinal hernias, Surgery is typically required to push the protruding intestine back into place and strengthen the abdominal wall. Modern hernia repair is safe and effective, often using a mesh to reinforce the weakened area. If the pain is related to a nerve issue, treatment may involve medications that target nerve pain, such as gabapentin or amitriptyline. In some cases, physical therapy or nerve blocks may be recommended. For chronic scrotal pain with no identifiable cause, treatment focuses on symptom management. Options may include pain relievers, nerve pain medications, counseling for anxiety, and sometimes surgical interventions if other methods fail. Now let's shift focus to prevention and self-care. One of the most important steps men can take is regular testicular self-examination. By getting familiar with how your testicles normally feel, you can more easily notice changes in size, shape, or consistency. This doesn't mean obsessively checking every day, but performing a self-exam once a month can be useful. To perform a self-exam, it's best to do it after a warm shower when the scrotum is relaxed. Gently roll each testicle between your thumb and fingers, checking for any lumps, swellings, or unusual firmness. It's normal for one testicle to hang lower than the other, and for the epididymis to feel like a soft, coiled tube. Another preventive measure is practicing safe sex. Using condoms and getting regular STI screenings can reduce the risk of infections that lead to testicular pain. Limiting the number of sexual partners and avoiding high-risk behaviors also plays a significant role in prevention. Maintaining good hygiene is also key. Keeping the genital area clean and dry prevents fungal and bacterial infections. Wearing clean, breathable underwear made from natural fabrics like cotton can help reduce sweating and irritation. If you're active in sports or physical activities, protective gear like athletic cups can help prevent testicular trauma. Sudden impacts from a ball, elbow, or fall can be extremely painful and sometimes dangerous. Now let's dive into lifestyle factors. Long periods of sitting, especially with tight clothing or hot environments, can lead to testicular discomfort. Prolonged heat exposure from saunas, hot tubs, or heated seats can also reduce sperm production and cause temporary pain or discomfort. Standing up, wearing looser clothing, and taking breaks during long sitting sessions can help. Stress can be a hidden contributor to testicular pain. Chronic stress affects hormone levels, immune function, and pain sensitivity. It can also exacerbate symptoms of existing medical conditions. Practices like meditation, deep breathing, exercise, and sleep hygiene can reduce stress and improve overall health. Let's talk about when pain is not from the testicles at all, but still felt there. This phenomenon, called referred pain, can confuse both patients and doctors. For example, pain from a kidney stone may radiate to the lower abdomen or testicle on the affected side. This type of pain is usually sharp, cramping, and may come in waves. Likewise, nerve compression in the lower back or pelvis can send shooting or aching pain to the testicle. Conditions like sciatica or piriformis syndrome affect the nerves that travel into the groin. A physical exam and imaging like an MRI may help identify these sources. Sometimes muscle strain from overexertion or improper lifting technique can cause groin or lower abdominal pain that radiates into the testicles. This is often misinterpreted as testicle pain when the real issue is muscular. In rare cases, autoimmune diseases or chronic pain disorders like chronic pelvic pain syndrome can lead to testicular sensitivity. These cases often involve widespread pain and other symptoms like fatigue, urinary urgency, or bowel issues. Treatment focuses on managing the broader syndrome with medication, physical therapy, and sometimes counseling. It's important to emphasize that ignoring testicular pain is never a good idea. Even if the pain seems minor, if it persists beyond a few days or worsens, medical evaluation is essential. Conditions like torsion require immediate action, and infections can worsen if left untreated. You should also be cautious about self-medicating without diagnosis. While over-the-counter painkillers may offer temporary relief, they won't address the root cause. Using heat or cold packs without understanding the underlying issue might actually worsen certain conditions. Always seek medical advice before starting any treatment on your own. Now let's address testicular pain in specific age groups. In young boys, pain is often due to minor trauma or testicular torsion. Pediatric torsion is a medical emergency and should be ruled out quickly. Parents should never ignore a child's complaint of testicle pain, especially if accompanied by swelling or nausea. In teenagers, trauma, torsion, and infections related to sexual activity are common causes. Open communication and proper sex education can help teens seek help early. In adult men, pain is more often linked to infections, varicocele, hernias, or referred pain from other sources. In older men, prostate enlargement and urinary infections may contribute to testicular pain. For some men over 50, the likelihood of testicular cancer is lower than in younger adults, but issues like hernias, chronic prostatitis, and nerve compression become more frequent. Annual health checks and addressing symptoms early can make a huge difference. Let's now discuss the emotional impact of testicular pain. Many men hesitate to talk about pain in the genital area due to embarrassment, fear, or misunderstanding. This silence can lead to delayed diagnosis, worsening symptoms, or long-term complications. Addressing the emotional burden is as important as treating the physical cause. When men experience unexplained testicular pain, they may immediately fear the worst, such as cancer or infertility. While these are valid concerns, most causes of testicular pain are not life-threatening and are treatable if addressed early. Still, the anxiety and stress associated with such fears can amplify the perception of pain, creating a feedback loop that makes symptoms worse. Psychological factors like health anxiety, often referred to as hypochondria, can cause men to become hyper-aware of bodily sensations. This increased focus can make normal sensations feel abnormal, or cause increased sensitivity in areas like the testicles. In such cases, reassurance from a doctor and possibly short-term therapy can be helpful. There is also a growing awareness of chronic pain syndromes involving the pelvis and genitals, such as chronic orchialgia. This condition is defined as testicular pain that lasts longer than 3 months without an identifiable cause. Men suffering from chronic orchialgia often undergo multiple tests and treatments, and the lack of clear answers can be frustrating. Management of chronic orchialgia often involves a multidisciplinary approach, including pain management specialists, urologists, physical therapists, and mental health professionals. Treatment options may include pelvic floor therapy, nerve block injections, medications for nerve pain, and counseling to address the psychological impact. Let's explore pelvic floor dysfunction, which is sometimes overlooked in cases of testicular pain. The pelvic floor muscles support the bladder, rectum, and genitals. When these muscles become tense, overactive, or uncoordinated, they can cause pain that radiates to the testicles. This is more common than many realize and is often mistaken for urological problems. Pelvic floor physical therapy, involving specialized stretches and exercises, can provide relief for men whose testicular pain is rooted in muscular issues. This type of therapy is gaining recognition in the medical community and has shown promising results in patients who have not responded to conventional treatments. Now, let's address testicular pain after ejaculation. Some men report discomfort in the testicles following sexual activity. This can be due to inflammation in the epididymis or prostate, or it may be related to pelvic muscle tension. In some cases, delayed ejaculation or prolonged arousal without orgasm can cause a condition called epididymal hypertension, often referred to colloquially as blue balls. While blue balls is not a medical emergency, it can cause aching and testicular sensitivity. The discomfort usually resolves on its own or after ejaculation. If this becomes a frequent issue, it's worth discussing with a healthcare provider to rule out other causes. Another area worth examining is testicular pain from tight clothing or physical strain. Wearing tight underwear, jeans, or athletic gear can compress the testicles and surrounding structures. Over time, this pressure may lead to irritation or chronic discomfort. Similarly, excessive cycling or horseback riding can place repeated stress on the groin, potentially leading to nerve entrapment or soft tissue damage. Choosing looser-fitting clothing, using proper cycling seats, and taking breaks during physical activity can help prevent this type of pain. If symptoms persist, imaging studies and a physical exam can help determine if nerve compression or other injuries have occurred. Next, let's explore testicular pain due to autoimmune conditions. Though rare, autoimmune diseases like vasculitis can affect blood vessels that supply the testicles. This leads to inflammation, swelling, and pain. Systemic lupus erythematosus, or Behçet's disease, may also involve the genital organs and produce pain as part of a broader pattern of symptoms. These cases often require collaboration between a urologist and a rheumatologist. Treatment involves immunosuppressive medications and careful monitoring. There's also a condition called Henoch-Schönlein purpura, more common in children, where inflammation of small blood vessels causes skin rashes, joint pain, and sometimes testicular swelling and tenderness. Though it usually resolves on its own, medical attention is needed to rule out complications. Let's shift to testicular pain from post-surgical complications. After procedures like vasectomy, hernia repair, or testicular surgery, some men experience ongoing pain. This can be due to scar tissue formation, nerve irritation, or inflammation. A condition called post-vasectomy pain syndrome affects a small number of men and may lead to long-term testicular discomfort. Treatment varies from medication and physical therapy to nerve blocks, or in rare cases, reversal of the vasectomy or removal of scar tissue. It's important to work closely with a urologist who has experience managing chronic testicular pain. Let's now talk about tumors and malignancies. While most testicular pain is not caused by cancer, it's important to be aware of the warning signs. Testicular cancer usually presents as a painless lump or swelling, but some men do experience discomfort or a dull ache in the affected testicle or the scrotum. Other symptoms may include a feeling of heaviness, sudden fluid buildup, or back pain if the cancer has spread. Regular testicular self-exams can help detect changes early. The good news is that testicular cancer, when caught early, has one of the highest cure rates among all cancers. Ultrasound is the first-line imaging test for evaluating a suspected testicular tumor. If a suspicious mass is found, blood tests for tumor markers such as alpha-fetoprotein, beta-HCG, and LDH may be ordered. Surgery to remove the testicle, known as orchiectomy, is both a diagnostic and therapeutic step. We should also discuss infectious causes from outside the genital tract. Viral infections such as mumps, influenza, or even COVID-19 have been reported to cause testicular pain in some cases. This pain is often temporary and resolves as the infection clears. However, in cases like mumps or orchitis, permanent damage to testicular tissue can occur. Similarly, bacterial infections that start elsewhere in the body, such as the bladder or kidneys, can spread downward through the urinary tract to the testicles. This makes early diagnosis and appropriate treatment important. Let's not forget that medications and substances can sometimes contribute to testicular pain. Certain antibiotics, chemotherapy drugs, or even recreational drugs may affect blood flow, nerve sensitivity, or hormone levels, leading to discomfort. Steroid abuse, particularly anabolic steroids, can shrink the testicles and alter hormone balance, potentially leading to pain or tenderness. Stopping the offending medication and seeking hormonal evaluation may be necessary. Hormonal imbalances themselves, even without external substances, may cause testicular discomfort. For example, low testosterone levels, high estrogen levels, or thyroid issues can sometimes cause testicular or scrotal pain indirectly. Hormone panels can identify these problems and guide treatment. Environmental factors may also play a role. Excessive heat, pressure from sitting long hours, or exposure to chemicals and heavy metals can affect testicular health. Taking steps to reduce environmental risks, such as avoiding prolonged laptop use on the lap, improving ergonomics, and reducing exposure to harmful substances, can make a difference. Let's take a moment to review important red flags that should prompt immediate medical attention. These include sudden onset of severe testicular pain, pain accompanied by swelling, redness, or fever, pain following trauma that doesn't improve, visible lump or hard area in the testicle, nausea or vomiting with scrotal pain, changes in testicle position, such as one hanging higher, discomfort that interferes with daily life or sleep. Ignoring these warning signs can lead to delayed diagnosis and serious complications. Prompt medical attention ensures the best outcome. We must also highlight that not all pain is dangerous, and some discomfort may simply result from benign or temporary issues. However, determining the difference between a minor issue and a serious problem is not always possible without a professional exam. Early medical evaluation is the best way to get answers and peace of mind. Whether the pain is from a pulled muscle, minor infection, or something more serious, you'll be better off knowing the cause and treating it appropriately. Now let's discuss the link between testicular pain and fertility. While not all testicular pain is related to reproductive health, certain conditions that cause pain can also impact sperm production, hormone balance, or the ability to conceive. Conditions such as varicocele, for example, are known to raise the temperature inside the scrotum and disrupt normal blood flow. This can impair sperm quality, motility, and count. If left untreated, a large varicocele might lead not only to discomfort, but also to infertility. Infections such as orchitis or epididymitis, especially when severe or untreated, can lead to scarring within the reproductive ducts. This scarring can block the normal flow of sperm, resulting in reduced fertility or even complete obstruction. Additionally, testicular torsion, if not treated quickly, can permanently damage or destroy the testicle. Even if only one testicle is affected, the other testicle may not fully compensate in terms of hormone production and sperm output, particularly if it is already compromised. Men undergoing treatment for testicular cancer may also face fertility concerns. Chemotherapy, radiation, and even surgery can affect sperm production. That's why sperm banking before treatment is often recommended for men who want to preserve their ability to have children in the future. Regular monitoring of testicular health, timely treatment of infections, and proper medical care after injury or surgery can all help preserve fertility. If pain is accompanied by issues such as reduced ejaculate volume, erectile dysfunction, or hormonal symptoms like fatigue or low libido, further evaluation may be necessary. Let's now explore how testicular pain may be different on one side versus the other. Many men report that only one testicle hurts when touched, either the left or the right. This can offer important clues about the underlying condition. Pain in the left testicle is more commonly reported with varicocele due to anatomical reasons. The veins on the left side of the scrotum drain into a larger vein that has a different angle of entry into the kidney vein, which can lead to higher pressure and pooling of blood. This makes varicocele more likely on the left side. Right-sided pain, on the other hand, might more often be associated with hernias, torsion, or referred pain from the appendix, especially in cases of appendicitis that radiates into the groin. While the side of pain isn't always diagnostic on its own, it can guide further evaluation and help narrow down possibilities. Imaging studies like ultrasound can confirm suspicions and reveal whether the issue is vascular, infectious, or structural. Next, let's cover testicle pain at different times of day. Some men notice their pain is worse in the morning, while others feel it intensify in the evening or after specific activities. Timing can provide valuable information. Morning pain may suggest nocturnal erection-related tension or sleeping positions that place pressure on the scrotum. Inflammation that has accumulated overnight may also be more noticeable upon waking. Pain that worsens in the afternoon or evening, especially after standing or physical activity, may point toward varicocele, hernia, or muscle fatigue. Activities that increase intra-abdominal pressure, like lifting, running, or even prolonged sitting, can intensify discomfort. Pain after sexual activity may indicate inflammation of the prostate or epididymis, while pain after long periods of inactivity may relate more to muscular tension or nerve entrapment. By tracking the pattern of symptoms, you and your healthcare provider can better understand what's triggering or worsening the pain. Let's also consider the role of body posture and movement in testicular discomfort. Pain that worsens when sitting for long periods, especially on hard surfaces or in tight pants, may point toward pudendal nerve entrapment or pelvic floor dysfunction. Some men feel relief when lying down, which can indicate a vascular cause, such as varicocele, where reduced gravity helps normalize blood flow. On the other hand, pain that increases when standing may suggest a hernia or swelling-related issue. Posture and lower body alignment can also influence muscle tension around the pelvis and hips. Tight hip flexors, hamstrings, or lower abdominal muscles may indirectly affect the testicles, especially if nerve compression is involved. Stretching, physical therapy, and ergonomic adjustments often help reduce these types of symptoms. Let's explore the impact of diet, hydration, and lifestyle. While food is not a direct cause of testicular pain, certain habits can influence related systems. For example, chronic dehydration can increase the risk of kidney stones, which may radiate pain to the testicles. A diet high in sugar and processed foods can contribute to inflammation, which may worsen symptoms in conditions like epididymitis or prostatitis. Alcohol, caffeine, and spicy foods may irritate the bladder and prostate, potentially increasing pelvic and testicular discomfort in sensitive individuals. Maintaining a healthy weight, staying hydrated, and eating a balanced diet rich in anti-inflammatory foods, such as leafy greens, fatty fish, berries, and whole grains, can support overall urogenital health. Smoking is also a major risk factor for both vascular disease and testicular cancer. Quitting smoking improves circulation and reduces the risk of multiple urological conditions. Now let's consider the difference between acute and chronic testicular pain. Acute pain comes on suddenly and may be intense, sharp, or throbbing. It often indicates an urgent problem like torsion, trauma, or infection. Chronic pain, on the other hand, is usually dull, aching, or intermittent, and may persist for weeks or months. Chronic testicular pain can be more challenging to diagnose and treat, especially when no clear cause is identified. It may result from nerve irritation, scar tissue, or underlying pelvic conditions. A pain diary can help track when the pain occurs, what makes it better or worse, and whether it's associated with other symptoms like urination, bowel movements, or ejaculation. This record can provide valuable clues and help guide treatment. There is also a condition known as intermittent testicular torsion, where the spermatic cord temporarily twists and then untwists on its own. This causes periodic episodes of severe pain that go away suddenly. If this condition is suspected, preventive surgery may be recommended even in the absence of current symptoms. Now, let's highlight less common but important causes of testicular pain. One is testicular microlithiasis, a condition in which small calcium deposits form within the testicle. While often found incidentally during ultrasound and typically painless, in some cases it may be associated with discomfort or increased risk of testicular cancer. Another rare but possible cause is testicular tuberculosis. This is more common in regions where tuberculosis is still prevalent. The infection can spread to the testicles and cause swelling, pain, and firmness. Treatment requires a full course of anti-tubercular medications. Cysts, or tumors in the spermatic cord, can also cause localized discomfort, especially if they press on nerves or blood vessels. These can usually be identified through imaging and may require surgical removal if they are symptomatic. Let's not overlook neuropathic causes, where the pain originates from nerve dysfunction rather than physical damage. In these cases, pain may feel burning, tingling, or electric. Conditions such as post-herpetic neuralgia after shingles or diabetic neuropathy can affect nerves leading to the groin and cause referred pain in the testicles. Treatment in such cases may involve medications like gabapentin, pregabalin, or tricyclic antidepressants that target nerve pain. In some cases, nerve blocks or even surgical intervention may be considered. We also need to consider the psychosocial dimensions. Men who suffer from chronic pain in sensitive areas often experience emotional distress, relationship issues, and reduced quality of life. Feelings of embarrassment, frustration, or hopelessness are common, especially if the pain interferes with intimacy, work, or everyday activities. Mental health support, whether through counseling, support groups, or psychiatric care, plays an essential role in holistic treatment. Addressing stress, anxiety, and emotional well-being is a crucial part of healing for many men. A team-based approach involving urologists, pain specialists, psychologists, and physical therapists often produces the best outcomes for chronic or unexplained testicular pain. Finally, let's talk about hope and recovery. Although testicular pain can be worrying and sometimes complex, most cases have identifiable and treatable causes. Even in chronic or unexplained pain, relief is possible with the right combination of medical care, lifestyle adjustments, and support. The most important thing is to not ignore the pain, not to suffer in silence, and not to self-diagnose based on fear. Early evaluation, open communication with healthcare providers, and a willingness to explore multiple treatment options can lead to real and lasting improvement. Your body is giving you signals, and responding to them wisely is the best path forward. Now let's explore how testicular pain may differ across cultural and regional contexts. In some parts of the world, men are more open about discussing reproductive or urological symptoms, while in other regions, these topics may be considered taboo. This cultural hesitation can delay diagnosis and increase the risk of complications. For example, in some societies, men may avoid visiting a doctor for testicle pain due to embarrassment, fear of judgment, or misconceptions about masculinity. Others may turn to home remedies or traditional healing methods first, which can be helpful for minor issues, but dangerous if they delay proper medical treatment. Raising awareness, improving health education, and offering judgment-free access to care are essential steps in encouraging men to seek help early. It's important to understand that testicular pain is a medical issue, just like a headache or a stomachache, and deserves timely attention without shame. Now let's move to testicle pain in athletes. Men who engage in contact sports, weightlifting, or high-impact activities may experience testicular discomfort more frequently than the general population. Repeated trauma, jarring motions, or pressure from equipment can all cause sensitivity in the testicles. Wearing protective gear, such as athletic cups, is a simple yet effective way to reduce the risk of injury. Proper warm-up, stretching, and posture control during physical activity also help minimize muscular tension that may refer pain to the groin and scrotal area. Certain exercises like heavy squats, cycling, or rowing may place pressure on the lower pelvis and lead to testicular pain, especially if form is poor or if the body is not conditioned properly. A coach, physiotherapist, or trainer may help correct biomechanics and prevent recurring symptoms. Let's also talk about testicular pain and sleep quality. Pain that interferes with sleep can significantly affect physical recovery, mood, and overall well-being. For some men, the discomfort increases when lying down due to pressure changes or inflammation. In others, tension builds up during the day and causes nighttime aching. Sleeping positions can influence symptoms. For example, lying on the stomach may press the testicles against the bed, increasing sensitivity. On the other hand, lying flat on the back with loose clothing may reduce contact and relieve tension. Using supportive sleepwear, pillows for alignment, and managing inflammation with physician-approved methods such as cold packs or medications can improve comfort during sleep. Consistent and restorative sleep also supports hormonal balance and tissue repair. Let's now explore testicle pain in relation to sexual function and relationships. When men experience testicular pain, it can affect confidence, intimacy, and sexual desire. Anxiety about causing more pain during sexual activity may lead to avoidance, which can impact relationships and emotional health. Communication with a partner is key. Discussing concerns openly can build trust and reduce pressure. In cases where pain interferes with sexual activity, a healthcare provider or sexual health counselor can offer solutions such as medication, exercises, or alternative methods of intimacy that don't trigger discomfort. Sometimes testicular pain is linked to conditions like prostatitis, which may cause pain during ejaculation, pelvic discomfort, or even erectile dysfunction. Treating the underlying cause can often improve both physical symptoms and emotional well-being. Let's not forget the role of hormonal health. Testosterone, the primary male hormone, plays a critical role in testicular health, sperm production, mood, energy levels, and sexual function. Low testosterone levels may not directly cause pain, but they can contribute to a variety of symptoms, including tenderness, shrinking of the testicles, or decreased sexual function. Blood tests can assess hormone levels and determine if hormone replacement therapy is needed. Lifestyle changes such as weight management, sleep optimization, resistance training, and reduced alcohol intake can also support healthy testosterone levels. Another important topic is testicular retraction, where one or both testicles move up toward the groin and may cause discomfort. This is often due to overactive cremaster muscles, which naturally pull the testicles up during cold exposure, physical stimulation, or stress. In most cases, retraction is harmless and temporary. However, if it occurs frequently or is associated with pain, it may be linked to nerve or muscular tension in the pelvic region. Stretching exercises, warm compresses, and physical therapy may help relax the surrounding muscles. Now let's review testicular self-care routines that can support ongoing health and prevent discomfort. First, avoid long periods of sitting with pressure on the groin. Take regular breaks to stand and walk around. If your work involves sitting for hours, consider ergonomic chairs and proper posture. Wear comfortable, breathable underwear, preferably made of cotton or moisture-wicking fabric. Avoid overly tight clothing, especially during exercise or in hot weather. Supportive underwear can be helpful during physical activity, but the scrotum should not feel compressed or irritated. Keep the area clean and dry. Shower daily, use mild soap, and dry the scrotum thoroughly. Sweating and friction can lead to irritation or fungal infections, which may cause pain and discomfort. Avoid applying powders or strong deodorants to the genital area, as these may irritate sensitive skin. Maintain good hydration. Drink enough water throughout the day to support kidney function and reduce the risk of stones or urinary infections. Balanced hydration also supports tissue health and circulation. Let's discuss mental health support for men with chronic testicular pain. Living with pain in a private and sensitive area can be emotionally draining. Some men may feel isolated or embarrassed, fearing others won't understand what they're going through. This emotional toll can affect work, relationships, and quality of life. It's important to normalize conversations around male health. Mental health counseling, support groups, or therapy can offer a safe space to talk about frustrations, fears, and coping strategies. Pain management programs often include psychological support as part of a holistic care plan. Sometimes addressing underlying anxiety, depression, or trauma can reduce the perception of pain and increase the effectiveness of physical treatments. The mind and body are deeply connected, especially when it comes to chronic pain. Let's now turn to new and emerging treatments for testicular pain. In recent years, researchers and clinicians have explored minimally invasive options to manage chronic testicular pain, especially when no clear cause is found. Nerve blocks, where local anesthetic is injected into specific nerves around the spermatic cord or pelvis, can offer temporary relief. These blocks can also help identify whether nerve irritation is contributing to pain. For some men with persistent, treatment-resistant pain, a surgical procedure called microsurgical denervation of the spermatic cord may be considered. This procedure involves cutting specific nerves that transmit pain signals from the testicle. Success rates are promising, especially for patients who have not responded to medication or physical therapy. Another area of research is neuromodulation, which involves electrical stimulation of nerves to reduce pain perception. While still experimental for testicular pain, this technique is used successfully in other types of chronic pain and may become more common in urology. Now let's look at how pain perception varies among individuals. Not all men experience pain the same way, even with similar conditions. Factors such as genetics, nerve sensitivity, past trauma, emotional health, and pain threshold all influence how pain is felt and interpreted. For example, one man with mild epididymitis may feel only minor discomfort, while another may experience significant pain from the same condition. Understanding your personal pain pattern, triggers, and coping mechanisms can help you and your healthcare provider choose the most effective treatment. Listening to your body and respecting what it's telling you is essential. Pain is a signal, not an enemy. It's the body's way of asking for attention, rest, or healing. Let's conclude this section by summarizing a step-by-step plan if you feel testicular pain when touched. First, stay calm. Pain in the testicles is understandably alarming, but most causes are not emergencies. Second, perform a gentle self-check. Look for swelling, redness, lumps, or changes in position. Avoid applying pressure. Third, consider recent activities. Did you exercise, lift something heavy, wear tight clothing, or have sexual activity that could explain the discomfort? Fourth, take note of any accompanying symptoms: fever, urinary issues, abdominal pain, or nausea. Fifth, avoid self-diagnosis. If the pain persists, worsens, or you're unsure, see a doctor, preferably a urologist. A simple exam, ultrasound, or urine test may reveal the cause. Sixth, follow through with the treatment plan. Take medications as prescribed, rest when needed, and go to follow-up appointments. Seventh, track your symptoms. Keep a log of when the pain occurs, what makes it better or worse, and any changes you notice. Finally, take care of your whole self. Physical pain is easier to manage when your mental, emotional, and social health is supported. You are not alone, and help is available. Taking care of your testicular health is a sign of strength, responsibility, and self-respect. As we expand further into the complexities of testicular pain, it's important to touch on preventive care, a crucial aspect of staying ahead of future health issues. Preventing testicular pain begins with awareness and education. Knowing the early signs of common issues like infection, strain, or torsion can help you act quickly and avoid complications. But beyond recognizing symptoms, long-term prevention focuses on maintaining a healthy body overall. Physical fitness supports circulation, reduces tension, and keeps hormonal levels in balance. Regular movement improves blood flow to the pelvic area and prevents nerve and muscle tightness. However, balance is important. Overtraining or using incorrect form during workouts can lead to groin strain or abdominal pressure, triggering pain. Stretch before workouts, focus on core stability, and avoid lifting weights beyond your capability without proper support or supervision. Weight management also plays a critical role. Obesity increases the risk of varicocele, hernia, hormonal imbalance, and diabetes, all of which can contribute to testicular discomfort. Maintaining a healthy weight helps reduce inflammation and supports urological health. Let's now explore how age impacts testicular pain. In adolescence, testicular torsion is a top concern due to the rapid growth of the testicles during puberty. Young men should be taught that sudden pain is never normal and always warrants medical attention. In adult men, pain is more often associated with infection, strain, or vascular conditions like varicocele. At this stage, lifestyle factors such as diet, sexual activity, and job-related stress play a larger role in testicular health. In older men, prostate enlargement, urinary tract issues, and referred nerve pain become more common causes of scrotal discomfort. Chronic diseases like diabetes and vascular disease can also contribute indirectly by affecting blood flow and nerve function. Let's now discuss differential diagnosis, or how doctors distinguish between possible causes of similar symptoms. For example, if a patient reports tenderness on touching the testicle, a clinician must consider many factors. Is the pain sudden or gradual? Is there fever, swelling, or urinary symptoms? Has there been trauma or intense physical activity? Are there signs of a hernia or mass? Physical examination, imaging such as scrotal ultrasound, and urine or blood tests help narrow down the diagnosis. Ultrasound remains the gold standard for evaluating blood flow, inflammation, masses, or structural abnormalities in the scrotum. A Doppler ultrasound specifically measures blood flow and can help rule out torsion versus inflammation. It's non-invasive, fast, and safe, offering critical insights into testicular conditions. Now let's focus on the importance of follow-up care. After a diagnosis is made and treatment begins, it's tempting to stop once the pain improves, but many testicular conditions, such as epididymitis or varicocele, require consistent follow-up to ensure full recovery. Failing to complete an antibiotic course, ignoring lifestyle recommendations, or skipping follow-up scans can lead to chronic or recurring symptoms. Set reminders, keep appointments, and communicate with your healthcare provider about any concerns that arise during your recovery process. Let's turn to case examples. Realistic scenarios that illustrate what might happen when someone experiences testicular pain. Case 1. A 17-year-old wakes up with sudden right testicle pain. It's sharp and intense, and he feels nauseous. He visits the emergency room, where a quick ultrasound shows testicular torsion. Emergency surgery saves the testicle, and he makes a full recovery. Lesson: sudden pain always needs urgent attention. Case 2. A 34-year-old cyclist experiences aching in the left testicle after long rides. Examination shows a varicocele. He switches to a supportive bike seat, reduces training volume, and his symptoms resolve with conservative management. Lesson: repetitive pressure can cause vascular issues. Adjusting activity helps. Case 3. A 45-year-old office worker feels intermittent dull pain when sitting long hours. He also has occasional groin numbness. MRI shows mild nerve impingement from tight hip muscles. Physical therapy focused on pelvic mobility and stretching resolves the pain. Lesson: not all pain comes from the testicle itself. Referred pain is common. These cases show how different the causes and treatments can be. Personalized care is essential. Let's now turn to sexual health and function, an important yet often overlooked aspect of testicular pain. Some men with persistent discomfort report reduced libido, trouble with arousal, or premature ejaculation. These may be due to physical pain, psychological stress, or hormonal imbalances triggered by the condition. Don't be afraid to bring up these topics with your doctor. Urologists are trained to address not only pain, but also its impact on sexual health. Safe, effective treatments exist, from medication and therapy to pelvic floor rehabilitation. Now let's cover male reproductive anatomy, so you can better understand where the pain might be coming from. The testicles are the oval-shaped organs that produce sperm and testosterone. The epididymis sits behind each testicle and stores maturing sperm. The vas deferens carries sperm from the testicle to the urethra. The spermatic cord contains blood vessels, nerves, and the vas deferens. The scrotum is the sac that holds and protects the testicles. Pain can originate in any of these structures, or even outside them, and still feel like it's coming from the testicle. That's why diagnosis can be complex, and thorough evaluation is necessary. Let's now list myths and misconceptions around testicular pain. Myth 1. Testicular pain always means cancer. Fact: most testicle pain is caused by non-cancerous issues like strain or infection. Cancer is usually painless. Myth 2. You should wait and see if testicular pain goes away. Fact: waiting can be dangerous. Torsion, for example, must be treated within 6 hours to save the testicle. Myth 3. If there's no swelling, it's not serious. Fact: pain can exist even without visible signs. Internal structures like the epididymis or nerve. Always listen to your body. Never ignore the signs, and remember, your health is your greatest strength.